The National Midwives Association have urged the government to improve the welfare of midwives for quality delivery of healthcare services to pregnant mothers. Annette Evelyn, the president, National Midwives Association, says they are struggling to provide quality services to mothers due to the thin numbers of midwives in the country.
We also hope to catch the eye of the government that they need to invest in midwives. We cannot give quality care when our numbers are still thin. When mothers come in with complications, it takes more resources.
Annette, who was speaking to NBS TV during an interview from Gulu City, urged the government to fill up all structures in the healthcare sector for effective service deliveries.
To resound our drums and call upon government to open up the structures to ensure that these structures are filled to capacity.
She explained that in Uganda, each midwife delivers more than 500 mothers annually against the recommended 175 by the World Health Organization.
A facility that used to serve 100 mothers is now serving over 400 mothers, up to 500 mothers, yet WHO recommends 175.
They are also advocating for midwifery model of care where mothers are encouraged to go through natural birth and not C-section, hence reducing medicalization of services.
We are advocating for a midwifery model of care. A midwifery model of care reduces on the medicalization of services. We are promoting natural birth that enhances a midwifery model of care, where the mothers are able to go through natural birth as much as possible.
Meanwhile, the program coordinator for UNFPA in Uganda, Ms. Julian Lunguzi, pleaded with the government to continue investing in midwives, noting that they are key in promoting child health.
Go to a facility, you find that you have one midwife working long hours and saving the whole community. Our plea is that government and all other partners, let's continue investing in midwives, because the midwives are being trained, but not everybody is being recruited. Why? Because of the resources. So let's also make sure that the resources are available.
However, Agnes Bago-Chandia, Acting Commissioner, Nursing and Midwifery Services, Ministry of Health, says the government has set aside modalities to improve the welfare of midwives.
The Ministry of Health and as a government, we have embarked on improvement of infrastructures. You have already noted that there are very many health center IIs which has been upgraded to health center IIIs, and also health center IIIs upgraded to health center IVs, and some other health center IVs have become district hospitals. So government has spent a lot of time in really improving infrastructure so that the distance for mothers to access care can be reduced. Have now developed a new structure which could be able to accommodate a number of midwives and other health force at those different levels.
The latest incident involved 26-year-old Nancy Akello, who last week delivered along Mutema Road while being transported to Lacor Health Centre III in Amuru. Monica Akello, a mother in Amuru, shared her dissatisfaction with limited numbers of midwives in our home district.
According
to UNFPA, the number of field midwives positioned in Health Centre III and above facilities has decreased from 1,961 in 2009 to 1,131 in 2015, hence increased in high mortality rate in the region. There is still a big gap of 833 midwives positioned in Health Centre IIs countrywide. Currently, Uganda has a total of 21,155 midwives registered with the UNMC that are eligible to practice. Although this has contributed to increasing the positions filled in public health facilities as per the Ministry of Health staffing norms to 75.3%, it is an equivalent of 1 midwife for every 2,000 population. Joe Pronocott, NBS, Live at 9.